Talking health now with Dr. Olatubi Olawale. We'll be discussing pain and its management. Now, let me let you know that Dr. Olatubi is a physiotherapist with specialty in sports medicine and orthopedics repair. It's such a pleasure, as always, to have you here.
Thank you very much, Mary.
Fantastic. So let's start by defining what pain itself is. What is pain?
Pain is actually an unpleasant feeling that you feel, and it's described as everybody has different kind of feeling for pain. So if you are having any discomfort, and it's showing that there's an underlying causes for that kind of unpleasant feeling, that's pain, and can be divided into two. You have acute and chronic pain.
Okay.
Acute pain is the sudden effect of pain. Probably you just hit your leg on the wall, on the one stool, and you sprain your muscle. It lasts for like 2 weeks, 1 to 3 days to 2 weeks. Then the chronic pain is kind of pain that lasts for 6 months, 3 months, pain that has always been there. That's pain.
So that's how you differentiate it. The one that is more or less recurrent, while the one that's just for a few days, maybe a couple of weeks, that's acute. Okay, so how do you manage acute? Let's start from there. How do you manage acute pain? Okay,
before even we talk about management, we talk about assessment of pain. Because I look at you and tell you, how do I assess this pain? Assessment of pain is depending on what you're feeling, because you are the one actually feeling this pain now. We assess based on, we call something a verbal rating scale. How is the pain? Is it intense? Is it mild pain? Is it sharp pain? Is it throbbing pain? Is it discomforting? That kind of thing. Then another one we do numeric scale. I give you on a scale of 0 to 10. What kind of pain are you feeling? Is 0 mean the least kind of pain? 10 means the highest kind of pain you've ever felt in your life. You tell me, oh, pain I'm feeling is 7 over 10. Then I know this pain is more. You tell me the pain I'm feeling is like 3 over 10. Okay, I know this pain is more. Okay, something that is very, very... then if I tell you, oh, this pain is 10 over 10, I know.
But that assessment, couldn't it be based on what that person is feeling at that moment? Because there's always the possibility that in 5 minutes' time, it might get better. Yes. Or the person might be exaggerating due to how intense...
Pain assessment is subjective. Is that it depends on what the feedback you give to your doctor. Now, you can, if you are feeling pain at the moment now, and so there's another thing we use, facial expression to know. If you're in pain, your facial expression, you cannot be in pain and be smiling. So sometimes we use facial expression to know the kind of pain we are feeling at that moment. Then acute pain is a pain that, okay, I just felt this pain in 2-3 minutes, or this pain has been there for a while. Now, management of pain depends on 3. It can be medicine.
Okay.
You can use a pharmacological way, that's medicine. That's using of drugs. Now, either you use most relaxant. It depends on the kind of pain you are feeling. Some people's pain is actually probably muscle tightness. Some people's pain can be a nerve pain. Some people's pain can be aching pain. So depending on the kind of pain, now management of pain, actually acute pain, can be through medicine, drugs, through drugs or injection. That's the first management of pain. The second management
That's for acute?
For acute, even for chronic
even
too.
For chronic as well, okay.
Even for chronic. So I'm going to talk the management even for acute and chronic now. Okay. It can be for management with drugs or injection. Then the next one is physical therapy, physiotherapy now. Instead of using medicine and drug, we use physical means. Now we can use heat, we can use ice, we can use exercise, and we can use massage.
Now, that brings me to a question. When you talk about, using ice or heat, how can you tell which one to use at a particular point? I ask this because sometimes people, you might just have a swelling and someone will say, put something hot on it or put something cold on it. And you're like, okay, how can you tell which to put and when?
Okay, when there is a swelling or where there's a pain somewhere, there's a sign of inflammation.
Yes.
Inflammation is when there's something going on somewhere inside the body. It brings out with swelling, pain, and redness. So the best thing to use to counter inflammation is ice.
Because there's already heat.
Because ice will reduce the blood flow, and to reduce the swelling. So if you use ice around the side, it reduces inflammation. At that moment, if you use heat, it can increase inflammation. So most of the time, acute pain, that's pain that is actually just very, very acute. Most people prefer using ice than heat. That's why you go to any any sports events,
always ice.
there's always ice, because ice reduces the inflammatory process at that moment.
But what about when do you use the heat?
The heat now, probably most time when the pain is actually chronic, there's no longer inflammation. Now you can use the heat. Heat actually increases blood flow. It relaxes the muscles. So heat is actually very good for pain relief. Ice is actually good for pain relief too.
Because you know, all these elderly people, they say, come, let me rub it.
No, rubbing.
Like, and they will use all this, now, what's it called? I'm trying to, if it was even Ori is nice now. all these mentholated balms, and then you are feeling serious pain. Okay,
It's not.
Good thing we've cleared when to use which. Okay, so please go on.
No, so I've said ice. Exercise too can use in relieving pain. Sometimes your pain you're feeling can be used to sedentary lifestyle. When you exercise, especially people with arthritis now, I advise them when you just walk around, when you exercise, you feel better. There's enough fluid going around your joint is free, your joint is flexible, pain reduces. Then the other mechanism for reduction of pain is psychological.